Thank you, KJP, and thank you for your personal story. Thank you all for having me back. Happy to be back here. I know families around the country are starting to make plans for Thanksgiving. Mine is. We're thinking about the holidays ahead. It's going to be here sooner than most people know. And we're all looking forward to a really good holiday season. The challenge with holiday seasons every year is it's also a time where contagious respiratory viruses like influenza, RSV, and again this year COVID spread much more quickly. And we have seen an increase in COVID infections, hospitalizations, and deaths each of the last 2 winters. And we are carefully monitoring the rise of several subvariants that are evolving rapidly and emerging around the world, including ones that evade some of our treatments. And given what we've seen in Australia this summer, our summer, their winter, it's reasonable to expect we're going to see a significant flu season this year. So we have some challenges ahead as we plan and as we look at the winter in front of us. But the good news is we are not helpless against these challenges, right? In fact, what happens in the weeks and months ahead will have a large impact on how the winter goes. And really what happens in this winter is largely up to us as the American people. So let me talk about what tools we have, what we can do to make sure we have a safe and healthy fall, winter, holiday season. We have updated bivalent vaccines that are designed to target the original version of COVID. I think you should see slides up. You do. Great. That target both the original version of COVID from 2020 as well as Omicron, the BA.5 version that's circulating right now. And based on everything we know about immunology and science and vaccines, these updated vaccines should provide a much higher level of protection against infection, against transmission, and certainly against serious illness and hospitalizations and deaths. And just like people get the flu shot each year, even if you've had the flu in the past or if you got a flu shot the year before, it's really critical that everyone 12 and older should go get this updated annual COVID-19 vaccine. So you're protected this fall and winter, and you're protected year-round. So my message today from this briefing room is very simple. Don't wait. Get your new flu shot and get your new COVID shot today. If Americans did that, we could save hundreds of lives each day this winter. As the Commonwealth Fund just put out a new report, a new analysis, they estimate that we can save as many as 90,000 lives and nearly 1 million hospitalizations if most eligible Americans got their updated vaccines. Now, that is just based on vaccines alone, which are remarkable and going to make a very large difference. But if we do better than that, if people get tested when they have symptoms, we know testing leads to a diagnosis leads to treatments. And treatments that we have available today for free keep people out of the hospital, keep people out of the ICU, prevent the worst outcome of all. And here is the most remarkable fact. 2.5 years into this pandemic, think about where we were in March of 2020. Here's the most remarkable fact. If you are up to date with your vaccines, and if you get treated, if you have a breakthrough infection, your risk of dying from COVID is now close to 0. I really think that is a remarkable progress. And as a nation, we are clearly in a much better place as well, right? COVID is no longer the same disruptive threat it was. And by the way, that did not happen by accident. It's happened because of the leadership of this president. His leadership on vaccines, on treatments, on testing. We're the first country in the world to authorize a BA.5 bivalent vaccine. First country in the world to make Paxlovid widely available. So as we look ahead to our 3rd winter of COVID-19, we are focused, like a laser, on bringing down serious illness and deaths. And the single most important thing people can do to protect themselves, to protect their families, to protect their communities, is to get the updated COVID-19 vaccine. Now let me tell you a little bit about what we're doing to try to make sure that that happens. First, we've made it widely available, easily accessible, and it remains free. That's point number 1. Now we're doing everything we can to get the message out about the benefits of these vaccines. We're focused on reaching people where they are. Set up pop-up clinics in state and county fairs around the country. Last week, the Healthy Trucking of America hosted a pop-up clinic called Million Mile Celebration at the Talladega Motor Speedway in Alabama to help drivers get their updated vaccine. Next week, we're going to be at the Texas State Fair in Dallas. Week after that, at the Jackson County Fair in Biloxi. And the week after that, at the State Fair of Louisiana in Shreveport. These are just some of the things. We've been building partnerships. We have a partnership with the 100 Black Men of America, which is hosting a vaccine drive today in San Antonio, Texas, and one in Savannah, Georgia on Saturday. And we're making efforts through both targeted paid and earned media efforts in the weeks ahead. We have partnered with retail pharmacies, and we're working with trusted messengers such as faith leaders in communities across the country. We're making it very clear that getting these updated vaccines can save your life, because we know these vaccines are safe and they are effective. And beyond vaccines, let me make one other clear point, because there's a lot of confusion. When you go on social media, lots of people like to pontificate on what the data says, so let me be very clear about the evidence. If you are over 50 or otherwise at elevated risk and you get infected, you should be seriously considered for treatments, because treatments are effective, they make a big difference, they can save your life. Now, let me finish off by saying we know there's more work to do with real challenges ahead of us as we head into the fall and winter and the holidays. We're doing everything we can as an administration to stay ahead of this virus. But if we all do our part, not just us in the administration, but Congress, the American people, I remain incredibly confident we can manage this virus for this fall and winter with less suffering, and we can have a safe and healthy holiday season ahead. So with that, let me stop and take questions, but thank you.
Thank you, Dr. Shah. Just in terms of the winter surge that the administration is expecting, can you be a little specific in terms of the numbers, what kind of range in terms of number of cases we're looking at? And then for the window of time that we have for people to get vaccinated ahead of the winter, like when does that window sort of close before that actually has a big effect?
Yeah. So we don't have a specific estimate of how many infections. Look, there are lots of different models out there. And we are tracking both internal government models, but certainly lots of external academic models. Most of them expect that we're going to see more infections as we get into November, December, January. It's what we saw the last couple of winters, so that's not surprising. In terms of when's a good time to get vaccinated, I've been very clear about this. I think people should go get vaccinated before Halloween. Why Halloween? Because it takes a couple of weeks for your immune system to kind of generate the benefit from that vaccine, and that means you will be ready by Thanksgiving and certainly by the holidays. If you miss the Halloween, is it too late? It's not too late. Again, it takes a couple of weeks for the immune system to benefit from the vaccine. So there's no time period where the window is out and you're no longer going to benefit. You will always benefit. But the bottom line is, if you do it before Thanksgiving, you're going to see family and friends. Before the holidays, a lot of socializing that goes on in December. It's going to be a really good time to get it done before Halloween.
Just a quick follow-up. Since the White House has now said the pandemic is over, can you just talk a little bit about what the message is for Americans as we head into the winter months? Can they behave as though it's business as usual as long as they're vaccinated?
Yeah, so the president was very clear. COVID is not over. There's a lot of work to do. We still have 300 to 400 Americans dying every day, tens of thousands of people getting infected every day. There is a lot of work to do. What we know is that if we want to keep people safe and protect them from serious illness, which is obviously priority number one, the number one thing that people need to do is get vaccinated. And the number two is if you have a breakthrough infection, you need to get treated. If people did those two things, it would make an enormous difference in preventing hospitalizations, preventing ICU stays, preventing deaths, and those are the top priorities.
So if the administration is laser focused on protecting people from serious illness, why are the booster uptake rates so low? Does this reflect a failure on the part of the White House administration to get people boosted?
Yeah, so let's...
Sorry, one last thing. Why haven't we heard from President Biden on this directly, given that he has the largest megaphone? We heard from him so much early on in the administration. Why isn't he speaking about this?
So let me start off by talking about where we are with the fall, this new COVID vaccine uptake. We estimate that, and again, we'll get new numbers from CDC, but as you know, those numbers always lag. We estimate that between 13 and 15 million people have gotten the new COVID vaccine through this past weekend. And we always expected this to build up over time. September, if you think about how flu vaccines tend to work, not a lot of people get the flu vaccine in September. People are just coming back to school. People are not thinking about the winter so much in September. It's really October as the weather starts getting cooler. I'm from Boston. People tell me this is Washington fall. But it is starting to get a little bit cooler here. I think as that happens, we tend to see a big uptick in flu vaccines. We're expecting more people to get the COVID vaccine. And we're going to do everything we can to get the word out. And all of us are speaking about it. And so I think you've heard about this from the Secretary of HHS, from the Surgeon General, me. I'm sure you'll hear about it from the President as well. The President has talked about the importance of going out and getting vaccines and getting boosted. So we all are very, I think, synchronized on making sure this word gets
The
out.
rates are so low, it's something not working.
No, I think, look, we expected in the beginning, the vaccines rolled out in September. We expected September to be a month where it would just start picking up. And then again, we'd really expect vaccinations to start happening in October. We're out there doing everything we can to make sure that that message is getting out there and helping people understand that if you want to stay safe and healthy this fall and winter, the best thing you can do is get vaccinated.
Yeah, in terms of the president getting out and talking about it, when is he going to get his bivalent booster? And also, what is your advice for people like him who have had COVID relatively recently?
Yeah, so we're still working on things. Look, the advice that all of us are giving is people should wait 3 months after they've had their infection. If you do the math of when the president had his infection, it's somewhere around late October. We're going to find a specific date when the president's going to get it. So I don't have a specific date to mention, but he's still in that 3-month window. Same thing for the First Lady. We're following the science here, and the evidence suggests that waiting a few months and after you've had your infection is optimal for getting the best immunologic response.
You had asked for $22 billion for COVID funding for next generation treatments, next generation vaccines. That money did not come through. Are you in a bad place heading into winter?
Well, so no doubt about it that our response has been hampered by that lack of funding, right? And I think even from this podium, I've explained that we still went ahead, we thought it was incredibly important to get the new vaccines. We did. We pulled money from we had money allocated for a stockpile of tests and personal protective equipment. Remember, having enough PPEs for doctors and nurses, pretty critical. We were going to have a national stockpile. We do not have an adequate stockpile of that or of tests because we had to pull resources to make sure that we had enough vaccines. We do not have funding for the next generation of vaccines and treatments. Our our vaccine campaign has been more limited because of lack of funding. So Congress bears a lot of responsibility for the complexities of the moment we find ourselves in. You can't run a national response to a highly contagious and deadly virus without adequate funding from Congress. Congress has been a great partner in the past. I remain hopeful that Congress will step up again, but it is undoubtedly true that congressional inaction has put the health and well-being of American people at risk.
Dr. John, 2 questions. When the vaccine first came out, there was a concerted effort for the least of these low-income minority people. Is there a concerted effort once again for this booster shot for minorities, low income? And also, you speak of the positives of the booster shot. There's a study out talking about women in their menstrual cycles, how vaccines, the COVID vaccines, have impacted them. Can you speak to that as well?
Yeah. So on that study, it affected for the first cycle, affected the menstrual cycle by 1 day, and then women's menstrual cycle returned back to normal. So there was a lot of, and that has been the most definitive study suggesting there are no significant long-term impacts on the health of women or their reproductive health. On the issue of making sure that we're both getting the vaccines out to disadvantaged communities, poorer communities, communities of color, no question in my mind that continues to be a major priority of the administration. We look at all these data stratified by race, ethnicity, income to make sure that we're not leaving people behind. That begins certainly by making sure these things are widely available and accessible in communities. But it also, that's not enough. We're working with community partners, community-based organizations to make sure that we're getting the message out in those communities as well.
As you're casting a broad net for the booster shots, is there a community or communities, are there communities that you're really concerned about this winter going into the winter season with potential COVID upticks?
Well, obviously, we're always most concerned about people who are at highest risk, right? And so what we know is that people who are older, people who live in congregate care settings, they tend to be the highest risk for poor outcomes. So again, when you have more limited resources, we're putting a lot of attention on making sure that those resources are going to people who are at highest risk, and that's going to continue to be a priority.
Dr. Shaw, is the thinking after these updated booster shots that Americans should expect an annual COVID booster, or is it possible with any new strains that we should expect this will keep happening every few months? How should people be thinking about that?
Yeah. So I think for most Americans, this is a once-a-year shot. And by the way, people think somehow that's We're making news. We're really not. If you think about it, take an average 40-year-old. If they got a booster last fall, they first became eligible for a new vaccine just a month ago. So essentially, for a majority of Americans, we've already gotten into a once-a-year rhythm. All we did by calling it an annual COVID-19 vaccine is call it what it already become. So I think the science on that is clear. For a majority of Americans who are not in the highest risk group, once-a-year COVID vaccine. I'm not saying forever. I don't know how long. Obviously, we'll see where the virus goes. For other people who are at high risk, I think about my elderly parents who are in their 80s. Yeah, they may need vaccines more often than that. And we're going to track the evidence and data. And if it turns out that for them an additional shot, let's say in the spring, is useful, obviously we're going to make sure that we do everything we can to make that available.
And lastly, President Biden did tell 60 Minutes that he thought the pandemic was over. Do you share that assessment?
So let me be very clear. The president also followed that up with COVID is not over. And said we are doing a lot of work. I am the COVID response coordinator. We are doing a lot of work to fight COVID, right? Hundreds of Americans are still dying every day. We think it's really important to protect Americans. And I know that for the work we are doing on protecting Americans against COVID, we have the full support of the president, and that continues to be the focus of our work.
Go ahead, and then Tyler.
Doctor, can you tell us your assessment of the new variants we're seeing and how infectious that you think they are, even for people who are fully boosted? And also, just what scale could this winter surge take? Or do you think it could be like Omicron levels from last winter?
Yeah, so predictions are always hard on these things, right? Because the virus continues to surprise us and continues to evolve. There are 3 or 4 subvariants that we are tracking most closely. They are, in different parts of the world. And they all arise either from a BA2 or a BA5 kind of lineage. And the reason we're tracking them is because they either have a lot more immune evasiveness or they render many of our treatments ineffective. Those are the 2 major things that get our attention. The good news is all of these subvariants do arise from a BA2 or BA5. That means our updated bivalent vaccines should provide a much higher degree of protection than the original prototype vaccine would have. Obviously, we're going to do the studies to figure out how much protection, but I'm confident that our vaccines will continue to work very well, certainly against protecting against serious illness. And then the curveball that we got last Thanksgiving with Omicron, none of us obviously can predict that with any certainty. So our job is to not be in the prediction business, but to be in the planning business. And so we have a whole set of efforts that we're leading in the U.S. government to be ready should Mother Nature throw us a true curveball like what we saw last spring.
And then Tyler and Karen, you can first.
In the first vaccination campaign, before you took this role, the Biden administration set goals for the percentage of Americans that they wanted to get vaccinated with 70%. Right now, it's less than 4% of U.S. adults. I'm wondering, around that number, I'm wondering if you guys are setting a new target for what you'd want to hit by Halloween, or if there's a goal that you guys are setting on the front.
Yeah. To be perfectly honest, we've set no internal goals, no external goals. We just have, my feeling on this is we want to get as many Americans vaccinated with the updated vaccine. We think it's clearly a better vaccine, an important upgrade from what we had before. And the more Americans, the better. So people often ask me, do you have a goal for how many people, how low you want to drive deaths down? The answer is no. Like, we have about 300 to 400 Americans dying every day. Too many. We want to drive that lower. 200 is better. 100 would be better than that. So we're not setting targets. We are focused on driving deaths down, getting more people vaccinated, and with a very simple goal, which is more vaccinations better, lower deaths better.
And just a quick follow-up. I know you've added some context to the comment that the president made on 60 Minutes, but do you think that his comment saying the pandemic is over has contributed to the lack of uptake in vaccinations for this new bivalent vaccine?
Yeah, let me be very clear about this. Majority of American adults go out and get the flu shot every fall. They don't do it because the president comes out and says we have a flu pandemic. Right? They get it because they understand that the best way to protect themselves during the fall and winter is to get the flu vaccine. In very much the same way, I think a majority of Americans understand that we're still, in a situation where COVID is around, it's still infecting a lot of people, getting a lot of people sick, obviously way better than where we were, and the best way to protect themselves is to get the COVID vaccine. So I don't think the president's comments has anything to do with what's happening right now.
Go ahead, Karen.
2 follow-ups, if I can, on topics that you talked about. When you say that you expect there to be a pickup in the pace of vaccines in October, did the White House miscalculate the demand for these new boosters when you asked Congress for the money for this?
No, remember, we had no money for this. And we thought it was really important, and I still think it's really important, that we have enough vaccines for Americans, for any American who wants it. And so we had no money. We asked Congress for money. Congress chose not to fund it. We went and had to pull money from other really important programs. We purchased about 170 million doses. One of the things that we know is that if we want to make it available in rural communities, if we want to make it available at motor speedways, you're not going to use up every single last dose. You have to be able to willing and be open up a dose of 10 and know that only 8 or 9 might get used. So you have to have a little slack in the system. And based on all the calculations, I think we've made sure to purchase enough vaccines so any American who wants a vaccine can get it.
You mentioned about pulling money from stockpiles of tests when you were talking about, to Tam's question. Knowing that you can't answer what might be coming in the fall and winter with the surge, should Americans be buying tests now and stocking up on tests so they have them in preparation for what could be coming?
What I would say is, the calculations that HHS had done, again, I think these were done before I arrived, suggested that if we got another Omicron-like event, we should have about 900 million tests in a stockpile so we can get it out to the American people, because it would take us 4 to 6 weeks for domestic manufacturing to ramp up again. We're going to have nowhere near that. So that is a real problem. We are going into this fall and winter without adequate tests because of congressional inaction. And I think it's really important obviously, it's important that we have enough testing. Again, we're going to do everything inside the administration to make sure that we have testing capability that we can ramp up as quickly as possible. But all of this is made just dramatically harder by congressional inaction. You can't fight a deadly virus without resources. And congressional inaction is really costly.
All right, thank you, Dr. Jacques.
Thank you all. I have to run off. Take care. Thank you.
All right.